You guys should now be seeing what I am seeing, and I have this PowerPoint up. We're going to be going over reducing back and neck pain. Sorry if I speak a little low. I am a bit monotone and just have a lower voice. So I'll try to project as much as I can. Otherwise, sorry, bear with me. All right. Take this. There we go. Perfect. So, who am I to tell you anything about back pain or neck pain or pain at all? I am from Joshua Tree, California. I moved here to New York in August, maybe September, definitely August 2014. And I started at Columbia University's physical therapy program. And from there, I went on to work at Orthology. If you're familiar with Orthology, they have a location down at Union Square. That's where I spent the past 3 years before coming up to NYP. So I'm now working at NYP Columbia. I'm back at 168th, and yeah, giving treatment to people I come to know and grow with. I feel like I've been able to help a lot of people thus far. I do have a ZocDoc profile, so I'm not just making stuff up. I've had many people who are very satisfied with what I've been able to do and helping them to alleviate their pain. I've performed some research. So while at Columbia, we have to complete these sort of like capstone projects. And my project, as well as my partners, we were able to look at like how chronic pain is affected and what are some interventions that we can do to help people along. And some of those interventions I'm going to be going over with you. A lot of those interventions came from my experience not down, but over in Seattle. So as a student, I had to go through these clinical orientations. These are kind of like a residency for medical doctors. And on this one particular internship, residency, if you will, I was in a clinic where my supervisor performed no manual techniques. That is, there was no massage to the neck, there was no mobilization or manipulation to the back, and we would just talk to patients about pain and how pain works within the bodies or in the systems. And they got better, right? Like, much to my surprise, it was everything that I wasn't learning about in school at that particular time. And yeah, like we were getting people better left and right by just communicating and explaining things. So that's going to be more my approach today. And I think I think it will be beneficial to you. We're going to take a good look at all of what I've been able to prepare for you, and you can tell me. If anyone knows or is maybe has had like extensive physical therapy, like you may know of like a David Butler, you may know of a NIO group, that would be the NOI group. But one of the instructors and part of that group is Luke. He is one of the founders at Orthology, the company that I used to work for at Union Square, and he now teaches chronic pain and how pain works in the system. So I worked very closely with Luke, whereas I've been able to like work, or he's been able to teach me techniques or different interventions that I can use for patients, and still very, very close friends. We still work together. And lastly, I want to share that I'm a physical empath. If anyone, for those who don't know what that means, it's well, I guess I have the ability to sense the same sort of pain that others may be feeling. I actually didn't know this until like a couple of weeks ago, where I'm talking to a patient who was complaining about like an old ankle injury. And all of a sudden, my ankles started to hurt. This is not new. Like, I've always felt this, but I never had anyone like give me a sort of diagnosis or an explanation as to why I was feeling it. I feel like this is important for me to share because a lot of the pains that I have felt, like around those with chronic neck, chronic low back pain, it doesn't. It's most times that I felt the same pain that they have. It hasn't come from an actual injury, right? And that's something I definitely want to share with you guys and absolutely drive home. And yeah, I guess that will kick us into the next slide. Um, so what you are expected to get out of this presentation is a little bit about like what's normal, like what you can expect from your body, what you can expect from your spine, from your neck, from your back, from your upper back, really from every piece of you. Like what is normal, what does normal look like, as well as like how you may be contributing to what is normal or what does normal look like, right? Because you might find that there's some things that you're doing throughout the day as well as some things that you're not doing throughout the day that might be making you maybe present the way that you do or feel the way that you do. And lastly, of course, I'm going to give you some tips to try to help you feel the way that you should feel whenever doing or performing any sort of activity, right? So those are the big things that we're going to focus on today. And yeah, I'll try to be short and succinct in going through them. So everyone feels, just going to move this over a bit. Everyone feels that their spine is unique, right? Like it's like I have this back, I have this neck issue. My spine twists this way. A chiropractor told me that my pelvis rotates that way. My PT says it has an upslip. This leg is larger than or longer than the other. Maybe I was born with this sort of torticollis where like my neck just kind of like sits forward. Like all these things come up, but like when we see the real extremes, we're like, oh, maybe I'm not so bad, right? Or maybe we've been given a diagnosis that we might have a disc herniation, or we might have stenosis. We have this nerve being pinched upon, or this disc has been ejected, right? Like as if we're like, a disc is the same as like a Walkman. We can just press the eject button and it's out. Yeah, we all have or have seen or been given these diagnoses. But again, when we see these extremes, we're like, man, like how do they do that? And there's no thought of, I wonder how their disc looks, or I wonder if they're always in pain. Like the two women on the left, they seem to be perfectly fine. And when putting this PowerPoint together, I didn't know, until doing so that Usain Bolt has scoliosis, right? Like the man's like the world's fastest man on earth has scoliosis, and he, of course, maybe he could run faster if he didn't, but I mean, he's not letting it stop him, right? And that's something I definitely want to drive home with you, that no matter how your spine may look, like there's nothing stopping you but you, right? So I just definitely need that to be addressed. Lastly, and I had this spelling up there on purpose. I'm sure you heard of this expression, po body's nerfic. I need to figure out how to really line this up where I can encapsulate everything. But nobody's perfect. There it is. I'm just gonna have to come off of the screen a bit. It's fine. You don't need to see my face, right? All right, so nobody's perfect, but you're more resilient than you think. This is an image from the NOI group, right? Where they're again they focus on pain and chronic pain and how it works, right? And we see like the image of the brain there because like we might have something up with our toe, but like the way that our brain interprets that issue, whatever that may be. You might have stubbed your toe, you might have accidentally stepped on glass or cut it or whatnot, but like you go on, like you keep walking, maybe not on broken glass, but after you've suffered that injury, you heal and you recover. But sometimes, like, maybe something might happen to our back or our neck, and like we just don't recover, and we don't move on, and we kind of get stuck in this mindset, that I have a herniated disc, and like something's permanently wrong with my back, and it's irreparable, and like this is it, this is my life, it sucks. That is not the case. Many people, actually, there's been research that shows that if I were to round up 100,000 people, it's actually more than half, but still, let's just say half of them, all of them get an MRI, but half of them show that there's a disc herniation. Of that half, a quarter of them doesn't have pain, right? Like, we're talking like a fourth of the amount of people that were rounded up. Some of them are going to have an MRI that says they have a disc herniation in their neck and or lower back, no pain. And there's another that's going to have a disc herniation in the neck or low back, and there's pain associated with. And then there's the other half, right, that have on the MRI nothing wrong with them whatsoever, and still half of them are going to have pain. And that's where you start to have to like wonder, like, where is this pain coming from, or what is pain, right? If the disc present doesn't seem to make a difference whether or not the pain is going to be present, then what exactly does that mean, right? And I feel like that's something you should definitely be questioning. If you do have a disc herniation, or if you do have a disc herniation in your neck or your low back, like, how much is that really impairing you, or is it really pain that's impairing you? And pain, as we'll find out, is not exactly an indicator of there being an injury, right? So after an injury, the body just wants to protect itself and prevent further harm, right? Like, if you were to sprain your ankle and you twist it, like, you're not going to think twice. You're going to try to keep it elevated. You're not going to try walking on it whatsoever. But again, that brain, right, it kicks in, because if you cannot put your foot down and there's a truck coming full speed, right at you, and you need to get out of the street, like, you might put that foot down to save yourself, right? And you're not going to be thinking about pain. And not that you need to be like living in an extreme state of hypervigilance, or you got your norepinephrine going off, like your fight or flight going off all the time. But like, it's just to say that there are some things that we can do to override the pain, or maybe even say like what is important. And in the end, I want to drive home that it's movement. Movement is. So pain is really like a smoke signal, right? Like, it will tell you like something is wrong, but I want to tell you exactly what it is that is wrong, right? Like, I've had patients, or treated many patients, they're like, oh, I'm in pain everywhere. And I ask them to describe it. Like, well, how would you describe pain? And like, how? I've never had to do that before. And in the end, it was really tight. Like, they were just tight everywhere, right? So I would ask you then, like, to communicate with your body, like, figure out exactly like what is it telling you. And sure, that might come with like some guidance, maybe even some like meditation, or I mean, the easiest thing would just be movement, right? Like, if you just move your arm, like, yeah, I feel pain, but like, yeah, but like, what happens if I move it this way? Oh yeah, like, that actually feels like tight in my pec, right? So definitely communicate with your body, and constantly be asking yourself, like, is this an issue of mobility? Like, am I able to, do I have the mobility in my hips, right? And is this a matter of flexibility, right? Like, am I able to bring my head and neck like to the side that I want without there being like a tug? Or is it just stiff? Like, going back to the mobility phase, is it strength? Am I lacking the strength in my core to make sure that I'm standing or sitting upright? Or is it stability, right? Like all your muscles working together to 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 formulate that sense of normalcy or stability, right? To give you the comfort to maintain a single position, whether it be a plank or sitting position for a period of time without you having to like kind of get lazy like in your sitting or your standing position, right? So those are things that I want you to kind of focus on, like in going forward. And in the exercise part of the PowerPoint, I'll definitely be questioning you or reinforcing that. So the next phase of the slide or presentation is going to be conditioning. We have this unintentional conditioning. When I think of conditioning, I'm thinking of like if you were involved in sports, like in basketball, football, soccer. We well, it was a period of time, almost like a preseason, where you're maybe going to the gym, you're doing all these different drills, like you're getting yourself ready for the season, right? Like it was conditioning, or maybe if you're just an avid gym goer, like maybe it's a warm up, like you're prepping yourself, right, for a particular event or the exercise itself. And when you're doing that, like you really have to take a look at like what sort of habits are you forming on a day to day. In the case that you're working from home, right? Because we're not thinking of conditioning and working out in this state. Like we're thinking like, how am I conditioning my body during my work from home? Because I'll tell you what, if you get Usain Bolt to sit for 8 hours or just stand in place for 8 hours, like some of you are, and sometimes, including myself, like he won't be able to do it, right? Because he's already conditioned himself to run sprints, right, and do that in the fastest way possible. He has not been conditioned to sit, right, to have a sitting marathon. Like his body is not ready for that. But we, over time, have conditioned our body to do so. So, many times patients come into the clinic. I say, well, is there something maybe that you did to cause this little back pain? And they're like, no, I didn't do anything. Like, I didn't do anything. And I say, well, sometimes not doing anything is doing something, and I ask, like, walk me through like a typical day for you. And for some of them, well, I wake up, I might go for a short walk, and I watch television. I'm working at a computer, I'm reading a book, and many times like the amount of time that they spend sitting throughout the day, like it adds up. And sometimes it's standing, sometimes it's like the amount of time that they spend like going up and down stairs. It's just walking. I had one woman, she just walked around a neighborhood like all day. It was part of her job. And, like she never gave her back a break, right? Like she's just constantly on the go. So like some muscles are tightening up, some are not. And, for others, like they just don't have the time to to stretch, to do some of the exercises that I'm going to go over today. Sometimes it's kids. Sometimes it's going from one meeting into another. Sometimes it's the weather. We may not want to walk out when it's raining or it's snowfall and it's ice on the ground. But still know that all these things do reinforce habits that we make or create, and those habits have lasting impacts on our body. One woman that I met during COVID, or as I'm practicing physical therapy, one patient that I treated during COVID was this woman. She is a project manager or program manager, and she's in between homes. She wanted to capitalize on the low interest rates. I digress. But still, she's in an Airbnb. She has a family there. Her husband's working from home. The kids are home because it's just like during the summer, like school is out or whatnot. And she like had a recent like newborn, like 6 months, 7 months old or whatnot, and like it was one meeting to the other. Like there was very little time. She had to manage up as well as manage down. So she'd tell her team or receive from her team a number of deliverables and have to deliver those objectives like to the higher ups. So I mean, like constantly busy, like managing a lot of people, as well as the kids, as well as just keeping like the home or the Airbnb nice, or like keeping up with the contracts, all this stuff. Like definitely juggling a lot, right? So she had plenty of hurdles. But you know, whenever she got the downtime, she would watch a bit of like Lovecraft Country and like read, right? So what position is she in? What position is she in when she's doing those things? Like more of the sitting. But I love these images because, and I wanted to add them because I wanted to show just how like comfortable we can get when we're in the groove, when we're constantly working. So we have this woman here who, you know, she's looking at the computer. It looks like she might be a little entertained, but still, like we're looking more at her posture. So if I were to like take a tracing of like the very top of her head and go, you were to like trace this with your finger, just hovering over your phone or computer, be able to go from like the very top of her head and like go down her back and down the back of her shoulder, down toward her lower back, then up toward her bottom, and then at the bottom or the back of her knee, right? Like it kind of looks like a C, right? Like kind of, right? And that's kind of like what we need to avoid, right? Um, I'll get into this a little deeper, but like this is really what I want us to look at. For those with hip or knee pain, if you take a look at her left leg, you see that that's a bit like extended. Her feet are like kind of pointing down, right? Like her toes are pointing away from her. Like, and all this makes a difference. So, what does she do? She might do yoga. She might do like Pilates. I mean, she doesn't, but still. But let's say she did. Like, she did yoga. She does Pilates. She does these different fitness classes. These are the things that she does. But what doesn't she do? Like, she's not sitting with proper posture. Like, she's not sitting in a position that won't tighten up her quads or hip flexors, right? We'll get into that a little deeper, but just wanted to like start off with that, right? Travis is another guy who I come across, um, or another guy that I treated during COVID. So he is into personal training. He's a massage therapist. 3 years ago, he started taking up like his studies to become a massage therapist, and it was during that time, he's studying full time. He's taking like jujitsu classes, right? And I've taken jujitsu, Brazilian jujitsu. Taken Gracie down at what was that? It doesn't even matter. It's a bit off topic, but anyway, like it's basically wrestling, right? Like you might be getting slammed, you might be put into like a hold, like a chokehold or something, and like you really have to like move your head like this way, that way to, you know, so like there has to be like some strength and stability there, right? But yeah, like he gets the stiffness or mobility, sorry, but he gets this stiffness and this tightness that surround his neck. He also gets like some discomfort in his low back. And again, if you were to, trace from the very top of his head down the back of his head, down the neck, the shoulders, his mid back, low back, his bottom, and toward like the back of his knees. Again, you see that C shape, right? He's kind of like pointing at the paper with his chin. Like this may not seem, or this may seem innocuous, like to some of you, but like doing this over a period of time, like this is not going to be helpful, as you probably know now, because you're going to end up watching videos on Facebook on how to alleviate your neck and back pain, right? Like this the position he's in now. He's probably watching this video right now. Sorry, Travis, but like this is the reason why you might find yourself, watching this video. So he can manage his pain with acupuncture, right? And he has been. He feels stiffness in his neck. If he gets a little soreness in his back, he gets acupuncture, and it definitely helps. And this is nothing at all against acupuncture, nothing at all against chiropractic work. But like he will eventually have to keep going to these to seek out these different treatments until he's able to either like correct his posture or like do something about the strength or the tightness that's being built up from maintaining this posture. So Mary is a bit younger than Travis. Mary's like 35. Travis is like maybe like 22, maybe 23. It's a bit of an age gap. But what they do have in common, I think a lot of us sometimes have in common, is the posture again that we hold. We tend to like that sort of like C-shaped posture, right? And during COVID, I mean, we found that we have even more in common because we have less, or we're less active than we have been, right? Like we've definitely been spending more time indoors. That is, if you're following all the protocols and whatnot. We definitely just want to be comfortable. I mean, we're already home. Like we're not thinking about like, oh, I need to be sitting bolt upright. Like just like relax, like taking one day at a time, one moment at a time. We definitely want self-care time, right? Like if we're going from one meeting to another, if we're studying for this exam, for that exam, if we're reading like all these books, like just to like know or like memorize these information for like quizzes or tests, like where do I get time to like, I don't know, like treat myself at least in a very safe and effective manner, right? Like some of us were maybe like fearful of going to a chiropractic care or physical therapy or acupuncture or massage or going to get a massage just because we weren't sure like of COVID. So again, that it brings me to like what can we do about it, right? Like what can we do about like treating our spine, treating our neck and back the way that it should, in alleviating some of the pains that we have in our joints, right? But a lot of it comes down to the way that we hold ourselves. So if you take a look at the skeletal picture on the left, we can see that the dotted line pretty much like goes through where the ear would be, right, and goes right through the midline of the femur and like down into the lower leg and like a little closer to the heels, right? And what we see on the right, just due to like poor posturing, like what would happen is like we're losing a bit of height, and that's because that neck is going to be like pushed forward, right? Like the person is now reaching a little bit forward with their chin. Their forehead is no longer in line with their breastbone. The upper back is a bit more curved, right? You can see that little bit of a C, and down toward the bottom we have this increase in curvature, and that mainly comes from what's happening when we're sitting, and that's going to be that pelvic positioning. So with our hips being flexed for so long, right? Like that has to have an effect. So again, I talked about conditioning. If your hips are flexed for 8 hours and you go to stand up straight, you've already conditioned your hips to be tight, and it's going to want to stay tight. It doesn't just loosen up because you decided, right? You're only going to be standing for a couple of minutes, maybe at a time, right? Or I'll give you the benefit of the doubt. You're standing for maybe 3 hours, but still you've been sitting for 8. So you're conditioned to do more sitting than you are to do standing, and that's really what this picture is kind of it's kind of producing here, a visual of. When we break it down to a musculoskeletal level, what we see here is Like we have tighter upper back muscles, right, as well as like tight pecs. You might have a tight lower back muscles. You see erector spinae, but there's another one back there, quadratus lumborum. I'm going to be talking about, as well as the tight iliopsoas. These are your hip flexors. Again, the ones that are helping you to sit. Right. So if you take a look at the image on the far left, you see the levator scapulae muscle. And that muscle, if you are having shoulder pain, shoulder and neck pain, and this might help you with your elbow, wrist, and hand. But this muscle connects directly to your neck, all the way down to the tip of your shoulder blade, right? And it's mainly responsible for bringing that chin and that shoulder forward, right? It's going to round that shoulder forward and kind of like get you into a ducking position, right? But you don't need to be ducking when you're at your computer, right, or at your iPad or your phone or any of that, or your book, right? Like, but that muscle is just getting tighter and tighter and tighter because we're maintaining that position. So by the time you want to use those deep neck flexor muscles right in through here, I mean, they've gotten so weak because they've gotten so stretched out, right? That you go to stand up, it doesn't feel normal, right? Same thing goes for the psoas and the way that they're now pulling at the pelvis to do this sort of anterior pelvic tilt. So if you're familiar with yoga or like Pilates, anytime you do like an anterior pelvic tilt, you're kind of like sticking your tail out. And when you do a posterior tilt, you kind of like sticking your tail in. I like to have patients go like back and forth between the two, where they can say like, yeah, anterior definitely feels normal, posterior feels weird, right? And that's just tends to be the case most times. And I would just have them focus on like maintaining neutral, right? Like going from one extreme to the other, just maintaining neutral. And sometimes what can prevent one from doing that, or what might make it feel abnormal, is that you have these psoas muscles, the psoas and iliacus muscle, which you can see on the picture on your right. That psoas muscle is connected to all of the low back bones, right? All the low back vertebrae, from L1 all the way down to L5, right? So they're literally pulling at your low back, and the muscle is also connected to your femur or your thigh bone, right? So it's going to, if it's tight, it's going to want to pull the low back toward the femur, and what you get is like knee to chest, right? So I'm just pointing that out. That knee to chest is coming together as that muscle gets tighter. You see the iliac muscle is on the inside of that pelvis. If that muscle is tight, it's going to want to tilt that pelvis anteriorly. And when that happens, you're going to get this sort of like compression at the low back, right? Like we see maybe the back is now coming at an angle, right? And it's going to feel like, man, like it feels like something is just like compressing my back, like it just feels uncomfortable. Well, that's really where that comes from. And the quadratus lumborum, we see erector spinae, like tight erector spinae, but most times it's really that quadratus lumborum muscle. This muscle is also connected to the same low back bones that the psoas muscle is connected to, right? But this muscle is to help you extend backward. So you have a muscle, quadratus lumborum, that wants you to extend backward, and then you have this psoas major muscle that wants to pull you forward, right? So what ends up happening is there's a bit of a tug of war that's happening. And what I try my best to explain to patients is this, what you're feeling in the low back with our quadratus lumborum muscle, or whatever is happening back there, that's actually the victim in this scenario. Whereas the psoas and the iliacus, those are the culprits. Like they are the driving forces that are causing you pain, right? So I just wanted to point those out because they're definitely going to be like what you are going to be targeting to alleviate your pain, your tightness, your soreness, all these things. Of course, procedurally or over time. So, sometimes we might be walking down the street, we might be watching a movie, and we see an older woman or a fellow, and we're like, man, I don't want posture like that when I get older, right? We're just like, I can't. And yet, every time we sit down, we're reading a book, we're reading or watching from our iPad, or looking at our computer. I mean, we are conditioning ourselves to have that particular posture. Like this guy, let's just say his name is Tom. Tom did not wake up like this. He did not just decide, my body is going to look like this going on, like going forward. This took years. This took time to develop, and that's something, or this is something that I want you to maybe like just observe, to sort of take in, and kind of just know that if you are sitting with this particular posture, this might be the trajectory that you're on, right? Because when you're sitting in this position, this it feels normal to you. So having or being in this position might also feel normal. If I were to ask this gentleman to bring this, or Tom to bring his forehead in line with his breastbone, he's going to be like, that feels so weird. I am not going to do that. It just doesn't feel comfortable, right? But this, again, kind of like those three images that I showed you at the beginning of the presentation, like that stuff didn't look comfortable either, right? Like those are just things that somewhat develop. So what may be normal to you may not be normal to the next person, but um, there is a more pain-free statue, or a pain-free posture that you can have, where there are no tightness or stiffness in any muscles. You are able to bring your body into or out of various positions. Yeah, and just want to I fear being redundant, or um, I don't know, insulting your intelligence, but I feel like it's necessary to point out the position that we put ourselves into daily can and will have a lasting effect on our body, right? So again, that goes to conditioning, and what you're doing and what you're not doing. So finally, for some of you, this is the point of the presentation that you've all been waiting for, where I have the interventions ready for you. And, I just want to talk them out. Again, there are like 3 points that we're going to be going over. Definitely the biggest one is switching up your setup, right? Like some of you are working from home, kind of like Mary, kind of like, Zach or Travis, where you're just in that C-shaped posture. We're going to take a look at exactly what is happening and what you can do to sort of reverse that. There's also the vacation mode. So this is like the first intervention, or the first few interventions that I might give a patient before we do any type of exercises. I am all pro like stretching and mobilizing before I get into exercising, because most times you may not even be weak in any particular direction. You might just be so tight that you can't move in the opposite direction, if that makes sense. So I'm going to show you how to like loosen up, just relax, and try to get yourself into a more like normal posture, and relieve your neck and low back pain. And again, for some of you, your shoulder, your hip or knee pain, by doing like the bare minimum, right? And lastly, we'll go over some stabilization exercises where you can strengthen both your cores. You're saying both cores, like what? I only thought I had one. But no, you have these deep cervical flexor muscles right in front of your neck, and we're going to be addressing how you can strengthen those, so you can get the muscles in the back of your neck to just hush up or just go away. Right, so we have, sorry, kind of moving off screen there. So we have this woman here who like many of us, might just be like going over a paper, like some research or like a PowerPoint. Um, or, might be looking on our phone or something, right? Like I've definitely caught myself in this position looking at my phone, like on the train or something. Um, but again, I just wanted to point out, like if we again trace from the very tip of her head to the back of her head, back of her neck, back of her shoulders, mid back, low back, her bottom to the back of her knee, we see this large C, right? Like if she were to keep this up, like we can expect her to have maybe a posture like Tom when she gets older, right? Where she gets that forward head, like rounded shoulders, and keeping up with that sort of like miniature like hunchback, right? So in order to correct that while working from home, it's going to be makeshift, but there are ways. We see this woman here. She has an external mouse and keyboard hooked up to her laptop, right? Like if this were in her lap, she's definitely going to have that sort of C shape where she's going to be like looking down into her lap. Her chin is going to be leading toward the keys, and it's just not going to feel comfortable. At least not after a couple hours of doing that. Doing it for like a couple minutes, 2 minutes, it's nothing. But doing that or maintaining that for an hour, conditioning yourself to do that for an hour, it's bad news, right? What else does she have? She has adequate lighting. Her laptop is up to her eye level. Like she doesn't have to look down very much. She doesn't have to look to the left, to the right. So if you're dealing with like multiple screens, if you find yourself looking at like one more than the other, like you might want to position yourself to where you're seeing that one screen, like better, like head on. You see that her laptop is like stacked on a book and a box, right? Like people are ordering stuff from Amazon all the time. I'm sure you can like chop up a box or like tape it up or something, like just to position it to where your laptop can sit on that, and you have yourself a bit of a stand. Again, these are for people who have the laptop or maybe like an iPad with the keyboard, the external keyboard and mouse. I think, man, you can save yourself from a lot of pain if you were to get this. Also, take notice, like she has this what looks like a pillow, like a lumbar support for her low back, and that's keeping it to where she's not like maintaining that curvature in her upper or lower back, right? Like it's pushing her back forward, and her thighs are pretty much like parallel. Her feet are flat on the ground. They're not like positioned up or down. Her toes aren't like pointing away from her or anything. She doesn't have her feet like tucked underneath the chair. Like I don't see anything wrong with this. The forehead is in line with the breastbone. Like it looks great. This is a position that like I would want to be in if I'm working from home. Um, there's one thing that I wanted to point out here. I can't seem to remember, but if I find it, we'll go ahead and come back. Um, yeah, we'll end up coming back. Yes, I remember. Sorry. So before I leave this slide, this might be uncomfortable for many people. Like this might look normal, right? Like she has a standing Z shape. Like it might feel comfortable for her because she may have conditioned herself to get into this position, but you may not have, right? If you've been sitting like this, right, for the past like 6 months, and you come across this video and you're like, all right, well, Brando wants me to do this, so I'm gonna do what Brando says, and then after 10, 15 minutes, you're like, Brando is so wrong. This is so uncomfortable. Well, I mean, you're partly right. Um, it is uncomfortable initially, right? Because this isn't your normal. The C shape is your new normal. But you would have to then condition yourself to get into this position. So, what this woman doesn't have, it said, it looks perfect. I wouldn't change anything. But what she doesn't have, or like maybe like a post-it that just says like posture, right? As a reminder. She might have a reminder on her phone that goes off. She might have a reminder on her laptop that goes off that just says posture, and she corrects it, right? Like I don't. Maybe she was sitting like more toward the edge of the chair, like into that C shape. Like she might be doing like a 5 minutes in the C and like 10 minutes in the standing Z position, to where she can like spice up her life, if you will, or she's constantly like changing her posture, but definitely spending more time in the proper posture position than the improper. Yeah. It's just something to keep in mind there. It takes time to change your normal. It doesn't always feel comfortable, but those are the growing pains. So as we talk about that sort of vacation mode, um, I want to first point out like two things that are just necessary for correcting the posture. One of them is going to be like a chin tuck. So we talked a bit about like that forward head posture. We see the guy on the left. I'm just going to move this over just a little bit. I'm going to be spacing myself out. Actually, I'm just going to move this over as well too. And just move over so I can stay in the frame. So we have this guy over here on the left, and his forehead is definitely not in line with his breastbone, right? So he's going to be having that forward head posture. Again, for some of you, looks normal, and maybe on the image directly to the right, where you might be having more of a superhero pose, like that might look abnormal or just uncomfortable. Again, I like the right in the middle, right? So where his forehead isn't entirely in front of his breastbone or in front of his body, to where he's like pointing at things with his chin, but it's also not like in this sort of superhero pose. So, but you definitely want to get closer to the superhero pose, is what I'm getting at, or at least again, just like meeting in the middle. It'll definitely help with adapting to the new or newer normal position. And the same thing goes for the anterior and pelvic tilt, right? So I mentioned this earlier, and I love the image that I was able to find online, where there's this cup that's superimposed across this woman's like pelvis. So we see with the anterior pelvic tilt, that cup is tilting forward, and the back edge of the cup is like pushing into her lower back, right? Like everyone can see that like there's like a bit of compression going into the lower back, and that's exactly what it feels like for many of you who might be like standing for like extended periods of time, or just like standing up from a seated position after a period of time, right? And then when she does the posterior pelvic tilt, like it's a bit more in line, like she's more stacked, right? Like a low back is more stacked on top of the underneath the upper back. And again, it's really a matter of finding like the neutral, not going from one extreme to the other, but finding like that middle ground. The picture on the far left, I love this. It doesn't look like a stretch, but it actually is. For all the shoulder people who wanted like a little tip or a video, I'd say really start with this position. Many times we sit with our arms crossed, or might be having our elbows in our lap. Like very rarely do we bring our elbows up and bring our hands behind our head. If your partner says, "Hey, what are you doing?" And you're lying in this position, let them know you're doing physical therapy. All right, because you are going to be loosening up your pecs, and if you're doing that chin tuck in this position, you're going to be loosening up like some of the muscles in the back of the neck, right? You can just hang out there, right? Like you're just chillaxing, and the longer you stay there, the longer you're stretching, like that's going to feel good. I highly endorse being in that position, right? To the far right, I said you're going to be kicking your feet up. This woman has a foot on her couch, right? And she's now going into a hip flexor stretch. So for those with hip or knee pain, as well as maybe video is for people with low back, this is definitely going to be crucial for you. Many people like to get into like the child's pose position because somehow that stretches your hip flexors. That makes no sense to me. But still, this is a stretch that will absolutely loosen up your hip flexors. So what she is doing, she has her foot onto like a short platform to where maybe she doesn't have to like stand. She can rest her knee on the ground. I mean, she has like a rugged surface or rugged surface where you can like put down a pillow so that it's not too much pressure on your knee. She's going to do that posterior tilt because remember that psoas and iliacus muscle wants to anteriorly tilt. She's going to do a posterior tilt to stretch them, and then she's going to squeeze her butt, right? And if she does that, a hip is going to come forward a bit, and she's going to feel a great stretch. What is missing from that picture? If she were to just raise her right arm, and start to tilt like a little bit toward the left, and she will stretch out that quadratus lumborum muscle too, right? That QL muscle that I said was playing tug of war with that psoas and iliacus, right? Like if she were to stretch that, then you put both of those muscles in timeout. These two muscles that's been playing tug of war, they're both in timeout. They're done. You can hold that for about 30 seconds. So research says that if you hold a stretch for 30 seconds minimum, like you can like get some like positive effects. Holding for 60 seconds is just as good as 30. Womp womp. But if you were to hold for 90 seconds, right? Research says that if you were to look underneath the microscope, that there are some biological changes that you can see, right? So not just the neurophysiological that you get at 30 seconds, but biological changes that you can see at 90 seconds of holding. I mean, who has that much time, right? Except, I mean, you kind of do. Like, I'm sure you can like move the laptop or the computer, or just take a break between meetings. I mean, just 30 seconds. Like 30 seconds late to a meeting. I doubt anyone's going to call you out on it. And you're just holding that, right? And you can get a bit of a stretch. The gentleman right next to her, or just to the left of that image, he's in the Sphinx position. I tried to look for a better image because this isn't exactly the way I would do the Sphinx. I would contract my glutes to keep my hips like pressed against the ground. If I still couldn't do that, then I would just move down to my elbows, and I would maintain that chin tuck. Like he's like still reaching with his chin. So he's kind of doing his low back a favor, but not so much for his neck. Lastly, what you could also do is just bend your knees in that position. You can alternate bending one leg at a time while keeping your knees like closer together. And that will help to loosen up your quads or your hip flexors further, right? Like I'm not going to go too much into the anatomy for those who might be here with knee issues, but one of your quad muscles does stretch across your hip and the knee. So if you're in this position for 30 seconds with your knees bent, you could definitely stretch out your quad and kind of loosen that up. Lastly, we see this woman using a foam roller, or this person using a foam roller. What they're doing, I love doing this. If you don't have a foam roller, I highly suggest you get one, especially if you're watching this video. What she's doing here, she's anchoring her hips to the floor, so she's not arching her back. She isn't. Her hips are anchored. Her low back is straight. She may have done like an anterior pelvic tilt, right? And then found neutral, and then she's locking her core in, and she's not letting that move. And what she is doing is she's allowing gravity to just take her head and shoulders and her upper back over the foam roller. So it's kind of acting like a fulcrum, right? Where it's just bending over the foam roller. And I would do that for like 2 to 5 minutes, or just lie on it in that position. It does not feel comfortable, at least not at first. I feel like that goes for anything involving the foam roller. You could be foam rolling your quads or your gastroc. Like nothing really feels good until you've done it for like a couple days or weeks. But afterward, oh my gosh, man, you'll get the release that you're looking for. for sure. So again, these are like more of my like passive approaches to releasing like the neck and the low back. Like these are like the simplest things you can do. Notice I mean, with the exception of the formula, like they don't require much. Like you can, let's say that Sphinx position, you can do that in bed. Vacation mode to the bottom left, you can do that in bed. Posterior tilts, you can do that standing, sitting, lying in bed. Chin tucks, so you're going to see on the next page. Again, you can do that in bed. Like these are all simple, easy stuff, right? Maybe if you're thinking about like how you're going to address this email or how you're going to present the deliverables that you have for your next meeting, you could be on the foam roller, right? Like just brainstorming, like how am I going to mastermind this? All right, we're finishing up. Here we have to the far left, this is more of the spinal stabilization, right? Like these are things I will want you to do in the case that you want to do like some strengthening to like go at that neck core, the deep cervical flexors, right? What this guy is doing, he's doing the chin tuck, but he's also adding a component to where like they're working like against gravity. So he's lying on his back, flat on his back. There's no pillow underneath his shoulders or his head, which is good. If you're sleeping with pillows underneath your shoulders, by the way, you should probably stop. But he's not, he doesn't have anything underneath his shoulders or his head. He's going into that chin tuck position and then he lifts it. This is a little higher than what I would recommend. I'd say it should be just high enough to where a single sheet of paper could slide through, right? And if you're holding that for about 10-15 seconds, for some people who have not done this exercise before, you're going to feel a burn, very similar to the burn that you feel in doing a plank, right? Like deep in that core abdominal region, like you're going to feel it. And again, another one of those exercises that you can do while lying in bed. You can do this before you get out of bed. You can do this before you go to bed. It's just easy. It's accessible. Like it's just always there. And again, you can do it on your own. No help needed. If you're feeling tightness as well as a little bit of stiffness in the neck, I have a couple of stretches that you can do. One of them is the armpit stretch. That's what the person in, I guess, the top middle is doing, where she is stretching out her levator scapulae. So I mentioned this muscle before. Again, this is the muscle that's going to help to bring the head down and forward and round the shoulders, again, to help you duck. But no one needs to do that when they're at the computer. So I'm going to go ahead and talk you through like how to do this stretch, right? So maybe I'll demonstrate here. We'll do this here. And I am going to, let's say I have tightness on my right side, right? So I'm going to rotate my head all the way over to the left. Then I'm going to use my left hand to grab the very back of my head. And then I'm going to gently, very gently, pull my nose down toward my armpit, right? So here, some of you may already be feeling a stretch, right? And in which case, I'd just say hold that, again, 30 seconds. If you want to do longer, let's go ahead and do 90, because 60 doesn't really make much of a difference from 30. So I'm holding this position for 30, but let's say I didn't feel much because I've been doing this stretch for a couple of days, a couple of weeks now. I can now bring my hand over to where I used to feel the stretch, and I'd raise my elbow. I'm kind of off camera here. I'm going to raise my elbow up toward the ceiling. My neck is doing no work. It's only my arms that are doing all the work, right? And again, I'm holding that for 30 seconds. Yeah. All right. The next stretch we see there is the upper trap stretch. So this is going to be for the muscle that's going to be connecting another muscle that connects the shoulder to the neck. As you can see in the photo, and you might want to practice this as well, he's grabbing the bottom of the chair. I mean, he could just be reaching for like his heels or grabbing onto the chair leg. But he's definitely having that arm, go down toward the floor while he's pulling his head in the opposite direction. He's still maintaining the chin tuck, but he's pulling the head toward the opposite direction. And again, like he's holding there for another 30 seconds. These stretches should be gentle, right? They should not be painful. If you feel like they're painful, you probably should just back off a little bit, right? And just be a little more gentle with yourself and definitely try to hold it, right? One stretch that is not on here because I just couldn't find a good enough picture will be very similar to the upper trap stretch, and I'm gonna walk you through it. So I'm grabbing the very bottom of my chair, right, and then I'm going to gently pull my ear down toward my shoulder, and then I'm just gonna rotate my head up toward the ceiling, right, and almost immediately you should be feeling a stretch right in the front of your neck, and that's for your SCM and for your scalene muscles, right? That's going to help to loosen up those muscles. For many people, after they come out of these like stretching positions, they tend to do this, right? And I have to, after a while, I'm like, why did I do that? And I find that they go from one normal, this new normal that feels uncomfortable, and then they go back to that forward head, like chin jutting out. So really try to avoid that position if you can. Like, please, it'll really be helpful if you could just avoid that. Just maintain that chin tuck. Just ride it through. Get used to being a little uncomfortable with the new posturing position at first. Lastly, we're going to talk about the McGill's Big Three back exercise. So Stuart McGill had come up with these 3 exercises that have been extremely helpful for many people experiencing chronic low back pain. And again, these are exercises that don't require much energy. Like you don't need to be doing like squats or anything with like 120-pound barbells or kettlebells or any of that. This is like low impact, but you can definitely like strengthen your spine and get your low back to where it needs to be. If you're still doing crunches, please stop. The first exercise is not a crunch; it's a modified curl up, and when you're doing this, what you're going to be doing, you're going to flex the hip and knee of the side. I believe it's the hip and knee of the side that you have been experiencing pain. I may have that wrong. I strongly think that is it, though. Either way, I mean, you can do both sides. But you're going to flex the hip and knee of one side and extend the leg of the other. And you're going to place your hands at the very small of your low back, right? And what you're going to do is you're going to do that posterior pelvic tilt. You're going to contract your abs or your core to try to smash or pancake your hands or your fingers. After you've done so, and I know this isn't like shown exactly as it is in the photo, but what you're going to do is lift your head and your elbows up toward the ceiling. You do not have to lift very far. It's going to kind of look like what that gentleman is doing all the way over to the left where he's lifting his head off the ground. Again, just as well as your elbows. And you're holding that for 10 seconds. Right, so you're smashing your hands, you're smashing your fingers, you're maintaining that chin tuck, you're lifting the head, and you're keeping that going for 10 seconds. And that's 1 repetition, right? So for his approach, he likes to do a 5-3-1 repetition pyramid or reverse pyramid, where he's doing 5 reps of 10, and then he'll do 3 reps of 10, and then he'll do 1 rep of 10. And you can cycle that through the other 2 exercises, so you could just knock it all out at once. I do recommend doing all 3 exercises in one day. All of these exercises are things you can do every day, by the way. But just 10 seconds. Over time, sure, like you may be able to do a 8-5-3 or an 11-8-5 repetition reverse pyramid. But that's as you progress, that will take place over like a course of days, and for some of you, weeks. The next exercise is the bird dog. So This I would say is like the most complicated of the three. I feel because it's well, you have to maintain like that chin tuck position. One, but you have to make sure that the low back is neutral as well as your upper back. So a lot of people when they get into the quadruped position, they just like let things hang. That is like that low back tends to go right back into that increased curvature. Same thing with the upper back, right? And you can even see with this image, like your head is like kind of tilted or like looking upward, like again like reaching with their chin. So what I would do like a posterior pelvic tilt, right? And then I like push my shoulders through the floors where my chest isn't like as close to the ground as it used to be. And then again, I go into that chin tuck to where my neck and my low back it forms a perfect line. Next, I progress to just raising up one arm. I know the image says to like raise your opposite arm and leg, but I find that it's easier for people to adapt to these exercises if they were to just raise like one arm um, and hold that for 10 seconds. And then you can bring that down and raise your leg for 10 seconds. It's much harder to do the legs if your hip flexors have not been loosened. So again, I focus more on lengthening, on mobility and flexibility before I get into strengthening. But if you feel like your hips are loose enough to do this, then you're good. Again, you're just going to be tightening up that core, making sure that there's no rotation. You're really going like as you see in the photo, like she isn't rotating her hips up. Like everything is facing in one direction and it's a straight line. Lastly, we have this side bridge. It looks like she's already like gone through the progression. Like again, this looks a bit advanced. When I started this exercise, because I did have a very short experience, I guess, with low back pain, and I actually started on my knees and came up onto my elbow. Because for some people, you might be more irritable than others and like going all the way onto the legs like that might be a lot of pressure through your shoulder but either way you're going to be again making sure that that chin is tucked, the neck is aligned with the upper back, is aligned with the lower back, is aligned with your hips and your legs, is forming a straight line, and you're holding that again 10 seconds and you do that reverse pyramid 5-3-1. Over time you can hold for longer than 10 seconds. You can go for 15, 20, 30, what have you. But that's totally up to you or as you see fit. These are not like substitutes for any other like strengthening exercises. If you love to do squats, if you love to do deadlifts, I'm all for it. But these are just like lower impact, I think, like very simple things that you can do to decrease or alleviate your low back and your neck pain. So, in closing, we are coming full circle here. Just some things I want to drive home for you. Pain, and just because you're feeling pain, or just because you've been given like a diagnosis that says you have like this disc and that stuff going on with your neck or your back, like it doesn't necessarily mean that you have an injury, right? Like that pain that you're feeling might just be tightness, it might just be soreness, it might just be from sitting for a long period of time. This is not to overwrite any doctor. Sometimes pain and some people have like a I don't know like a fracture in their spine, right? Because they had this very traumatic experience or a traumatic injury. Like, no, of course, like the pain is definitely, coming from that. But for most people, again, if you're like working from home where you didn't do anything, right? Like it doesn't necessarily mean that you're causing any irreparable harm. It could just be that you're a little tighter than usual, right? You may be unintentionally conditioning your body for a sitting marathon, right? So be sure that you're I mean, I don't want you keeping a log of how much time that you're spending in like the sitting position or standing position, but just be cognizant of where or what you are doing with your time, because you might be conditioning yourself to be a hunchback, like you might be training for that, and that might not be where you want to go or what you want to be. Lastly, I've given you some tricks and some tips on what you can do to help you with your as you continue to work from home. For some of you, and for others, you might just be having like some lingering upper or lower back pain. It's never too late to change what you're feeling or how you're feeling, your level of fitness, or just your overall shape. Um, though it does take time, please be patient. I've had patients, they come to me, they have pain all the time. They can never sleep, and they might get like a day or like I guess a night without pain, and the next day they get it again, and they tell me like, "Damn, man, I thought I was getting better." Sorry, excuse me, and for the cursing. And I'd say, well, you had one night where there was no pain. I would take infrequently or random pain over chronic pain any day, right? Because that random could it could there's a sliding scale for that, right? Like I can get a random pain like once a week, or I can get it once a month, or like once every few years, or generation, decades. I don't know, but still, it's better than having that pain all the time. So if you find that you're doing these exercises, and sure there might be like some growing pains, and then things start to turn, and you might fall back into that old habit or two. Maybe you get on the plane when things start opening up and that pain starts to come back. Just go back to this video, watch it again, or write down any lessons that or interventions that you thought were the most helpful. Just go back to doing those. Right? It doesn't mean that you did something wrong. It just means that you may have gone back into like some of your old patterns. So now that we're at the end of the video, what I want you to do is go ahead and create a routine for yourself. Write it down. I find that the more that we write our goals down, the more we seem to accomplish them. It's a very funny and interesting thing that happens. So what I want you to do is definitely write down like some of the exercises, some of the stretches that you want to do before you get out of bed or before you go to bed. Create like your own little routine. Again, like allow yourself some time to do these things. Mary, the woman that I mentioned before, she loved her Lovecraft Country. I said, look, if you're going to be sitting during Lovecraft Country, like you at least sit with the chin tucked, right? Like take your good with the bad. Like if you don't feel like doing the chin tuck, like you got to do it. Like you got to spend time to do that, right? If you're going to be reading, does it really matter what position you're in? Like, can you do that on a foam roller? Can you do that like as close as you can, like in vacation mode, right? Or like in the Sphinx position where you're lying on your stomach. Like there are different ways to compromise to get these exercises and stretches done to alleviate your pain. So we can start crossing off like some of those hurdles or some of those barriers that may be stopping you. Definitely use reminders. I had to turn mine off during this presentation. Otherwise, I definitely would have stood up about 20 minutes ago. And yeah, just set a reminder on your phone, on your laptop, like just fix your posture or a standing break, right? Or you just stand, you might bend backward, you might do a stretch and hold that for about 30 seconds. Challenge yourself, the 30-second challenge. Like I dare you to stretch between meetings. Like please entertain me, like a little bit. That 30 seconds might make a hell of a difference going forward. Also just take some time, like 2 minutes walking. I don't know, like it doesn't sound to me like very much of a struggle. If it's not walking, at least stand like 2 minutes. Like and just be on both feet, like no like hanging out or locking one knee over the other. Just hang out in that position. And definitely track your progress. So A lot of times, like I mentioned, like some people that might get better, and then the pain comes back, and they're like, "Oh, what did I do?" Well, if you were keeping track of your progress, you may have seen that you're now able to do a chin tuck for like 45 seconds and a plank for 2 minutes, right? And because you haven't been, you just think that, well, my pain is, nothing has changed, and maybe I need to go back and see the acupuncturist, chiropractor, or physical therapist. I challenge you again to just track your progress, because you may be able to fix this on your own. If I didn't believe that you can do that, I would not have made this video. And I respect your time, and I very much respect my own. So please, please, please take track of your progress. Try these exercises. Give it a shot, and be patient. Again, we saw that image earlier of Tom. I named him Tom. He did not wake up in that position, right, with that forward head posture, rounded shoulders. Like, that took time. And it's the same thing for the lower back for some people who might have that chronic anterior pelvic tilt, or might be feeling like they can't move their spine one way or another. Like, we are conditioning ourselves, but you can, push yourself in the other direction, right? So the body can and will adapt in your favor, but you must lead it. So if you teach your body to be strong, if you teach your core to be strong, if you teach your deep neck flexors to be active while you're sitting or reading, if you teach yourself to be sitting more upright, if you teach yourself to remain in vacation mode, you'll find that your shoulder, your neck, your arms, your legs, your hips, your knees, like all those things are going to loosen up for you, right? So I hope that you find these tips useful and beneficial to you. I look forward to hearing like some of your feedback. I'm excited to see like what comes of this. I mean, this has been fun to me. I like helping friends in my neighborhood, both the ones I have met and the ones I haven't yet. If you see me around Inwood, please say hi. Yeah, I'm just happy I've been able to help. If you have any questions, please contact me via Facebook. You can always chat me, or you can email me. You can please share this information with friends. The more people I can reach with this information, the better. I want everyone to be pain free, like really. And if you all want to know more information, let me know. I know I came to the community post to get your feedback on what you might want to hear, but I won't post things willy nilly. There's already a lot of PTs out there, or chiropractors, or different fitness gurus that are giving you a lot of information, a lot of it unfiltered. Let me know if you want this information. I can put together a website or a email chain or something. But the interest must be shown in order for me to take that route. So if you're interested in that, please let me know. Otherwise, yeah, I hope you enjoyed, and best of luck on your pain-free journey.